Okay, we continue now with Breast Week, and now I
You're
can't...
not even comfortable saying that.
I'm not. I'm really not. But I can't answer this question. But women have always said, wouldn't it be nice, I don't know, if you could take fat from one part of your body and put it, say, in another part of your body?
Oh, come on, from here to here. Yeah, I mean, women have always joked about that, but you know, it wasn't possible. It seems logical, and although fat transfer surgery has been possible for years, it was frowned upon because the fat could actually mask tumors and make mammograms very difficult to read. But now that has changed, and new screenings make transferring some of that fat from areas where we don't want it to places where we do possible. Very few doctors are performing this surgery. One is right here in the metro area, and today we are the first TV station to take an inside look at breast augmentation with fat cells.
Gosh, I'm feeling a little nervous right now, but mostly anxious. Having 2 kids kind of took over my body, and I haven't been able to, get it back into shape. Putting my own tissue, into my body and in just another area is, for me, it's just a great option. Sound like it's going to be too bad.
Sherry Free is not afraid to try a procedure not many have undergone. Fat cell transfer is not new. It's been done for lips and aging faces, but for the area most women want to be full and natural, it wasn't working.
The controversy with fat transfer to the breast area was whether or not it would mask tumors or if it would be confusing for the radiologist with mammograms.
Advancements in radiology are changing that and allowing doctors like Dr. David Broadway from Broadway Center for Plastic Surgery to perform fat grafting procedures in the breasts. In fact, the American Society of Plastic Surgeons has a fat graft task force, and a recently released report from them says concern regarding the interference of fat grafts with breast cancer detection is not validated by the limited number of studies available on the topic. That report gave the green light to U.S. doctors, and Dr. Broadway is one of the first to jump in the race.
I like it because it gives me a little bit more control. I can, again, adjust specific areas of the breast. You can fill in defects. You can fill in areas that don't have as much volume as maybe the opposite breast would have. So it gives you a little bit more control than just an implant.
So Sherry is one of the first patients in Colorado, and Dr. Broadway is taking fat from her back through liposuction, and he's injecting it into her breasts. The injections will go into multiple places. He says they will look and feel very natural. 3 weeks after surgery.
Hello, hi. How you doing?
Sherry made it through the recovery period and is excited about her initial results.
Are you glad you went this way instead of an implant?
Absolutely, yeah.
Good.
Yeah, I think the recovery was a lot better, and I like the way it looks. It looks very natural.
She still has some recovering to do. The swelling from the liposuction will take more time, but the result of her fat injection is more clear.
Let's take a look-see. See how you're doing there. There we go. There you go. Good. Wow, that looks really good there.
Turned out nice.
And all your bruising is pretty much gone.
You can see here the fullness in her upper breast. On the left, the before. On the right, the after picture. This isn't a procedure for someone who wants to go up a few cup sizes, but for a natural and fuller look, it might be the answer many women have been waiting for.
The big differences are, one thing that I laugh about is that I can wear tops that I've kept in my closet that I loved, but I couldn't quite, fit into. It just didn't look right.
And I should mention the results from the liposuction are very good too, but it can take 4 or 5 months for the swelling to go down to see those real results. So we'll revisit this story and show how Sherry is doing a little bit later.
She's a brave soul for allowing you to follow along and do that.
She
I mean,
sure
it's a good story. It's an important, a lot of trust.
That she put in us to make sure that that video came out the way it did. We should mention Sherry's 42 years old, and for those of you who might be thinking of this type of procedure, it's not for everyone, especially for people who are at high risk for breast cancer. So we put Dr. Broadway's website on our website at kdvr.com if you want more information.
And we'll be right back on Everyday right after this.